My dear brothers and sisters, you know that the modern society is fast changing in all fields: health, education, science, technology, management, economics, business, arts, music, dance, sports. Such fast changes going on. Full screen, brother. Yeah, thank you. So there have been tremendous contributions of modern era of science and technology to this area. Among various challenges, various contributions, I consider three major contributions. Air travel, computers, and television. They completely changed our lifestyle. So, in the field of modern medical system, allopathy, also there have been tremendous success in dealing with infectious and contagious diseases. We started developing vaccines, pharmacological interventions, antibiotics, painkillers, and surgeries. All started bringing tremendous benefits to everybody. So we were so enthused by the end of the last century almost that WHO announced that we'll bring health for all by 2000. That was the big announcement made. Everybody was so enthusiastic. But then what happened? As we reached the end of the last century, then new challenges started coming up. And at the base of these things, we have stress as the major factor. Stress has started engulfing the whole globe with such speed, with exponential growth. So look at the health hazards, the non-communicable diseases, asthma, diabetes, hypertension, heart problem, epilepsy, migraine, irritable bowel syndrome, cancer, and whatnot. Large number of psychiatric problems, anxiety neurosis, psychosis, everything is increasing. And in the field of education, it has started increasing the student unrest, the drug culture, alcoholism, gun, terrorism. And there is lack of total personality development and social responsibilities. So stress and health hazards, particularly in the form of non-communicable diseases, is leading to pain, suffering, and death. The number of deaths have started increasing, and it is even getting more than the infectious and contagious diseases that you have, all in that sense. And naturally, the modern medical system wanted to find out, can we have some vaccines to deal with diabetes, hypertension, cancer? So what are the antibiotics that can completely cure these diseases? Everything we tried for decades, but no result. So it has come to pass that there is no cure to these ailments. Once a diabetic, ever diabetic. Once you get hypertension, you must take on taking medicine for your life. Never think of a cure. If you get cancer, your days have numbered, have come to pass. No cure. In spite of all the achievements in medical system, we developed such powerful pharmacological intervention. So our medicines start working at the muscular level initially, the nervous system level, the cellular level, and the neurotransmitter level. Such powerful pharmacological interventions, such powerful medicines we develop. A large number of surgeries, 5,000 types of surgeries. And to make such surgeries, we have specialists, super specialists, and super specialty hospitals have come. but no cure. Why? Essentially, they deal with only the symptoms of the disease, not the root cause of the disease. If you look at one side, we have built skyscrapers, information technology, the web, social media spread, fantastic diagnostic tools, powerful pharmacological interventions, and large number of surgeries and so on. And there are universities and mass education using high-end technologies. AI has started coming up in a big way. With all that, no solution. Why? This is the most important thing that we have to look at. Also, why should we integrate? Why should we go for integrative medicine? Is it because that yoga, Ayurveda, and AYUSH is all only because of India? We love that we should have? Or is there a fundamental reason why we have not been able to tackle these NCDs? No? I consider there is a fundamental reason. That reason is what I call as the knowledge base. What is the knowledge base that we have in modern science? Modern science started almost 4 centuries back. What is the objective? Search for reality. Is there a fundamental reality from this whole universe has come? And what are the laws covering them? Newton and Descartes, they started the ball rolling, developed scientific methodology. We should not assume anything for granted. You have to conduct experiment. You have to design experiment, conduct the experiment, repeat the experiment. If you get the same result in different places, multi-center trials, then only we'll accept. Otherwise, we'll not. This is the evidence base. This methodology was developed. And we started trying to find out what this whole creation is made of. Soon, Newton and Descartes found that this world is very complicated, very sophisticated. You don't know how even an object falls down, how the raindrops occur, how the lightning occurs, how the thunderbolt occurs. These are all things physical. What to talk about the devils, pishachas, gods, goddesses, consciousness, mind, beyond our capacity. So let us start with things which are simple, down-to-earth, concrete things of this world. Once we complete this understanding, then we'll go to the subtle thing. It took 400 years to understand this entire physical world. Today we are in a fortunate position that we know that every object is all made out of molecules. Molecules are made out of atoms. Atoms are made of protons, neutrons, electrons, fundamental particles. What are they made out of? They're all made out of quarks, packets of energy. So everything in the physical world is nothing but energy, energy, energy. You can calculate how much of energy is in given mass. For example, if this mobile, if I convert this into energy, probably it can burn up the whole of Bangalore city. Just 10 grams of hydrogen bomb burnt up the whole Hiroshima. Such is the immense amount of energy packed up. All of you know about the equation, equals mc square. M is the mass, c is the velocity of light, c into c. Then we also understood the laws that govern them. Newton's laws of motion. So the 3 laws of motion that we all are aware of. This is known as classical mechanics. According to Newton, in this world, everything is determined. There is no ambiguity. If I leave an object, it is going to come down by 32 feet in 1 second. If I launch a rocket to the moon, you can trace the entire trajectory every millisecond. Mathematically accurate. You can calculate. This is known as classical mechanics. This is known as deterministic approach. But when you go to extremely high speeds, like electrons spinning around the nucleus, the speed could be as fast as nearing the velocity of light. Then Newtonian mechanics will not hold. Classical mechanics will not hold. deterministic collapses. What do I mean? If you leave an electron can come down, electron can go up, electron can go to the front, to the back, to the right or left. In fact, an electron develops like a globe. So you cannot say where will be the electron exactly after 1 second. It can be here, it can be here, it can be there, it can be there. What to do then? We can only talk about the probability of finding the electron here is 1%. Probability of finding the electron there is 0.01%. Probability can calculate it. The equation is known as the Schrodinger equation. This comes under what is called the quantum mechanics. Therefore, we have understood everything about the physical world. We know what it is made out of, energy, what are the laws that govern them. Classical mechanics, quantum mechanics, theory of relativity, probabilistic mechanics, everything. Therefore, anything physical, we have been a big success. Putting man on the moon, building skyscrapers, underwater tunnels, information technology, dealing with function, pollution, infectious and contagious diseases, sophisticated surgeries, everything being physical, we have been a big success. Now, what is happening to science? Science is in a turning point. Wrote Fritz of Capra, the very famous quantum mechanic, mathematics person from United States, 1983. I remember in that book, he traced the whole history of science. Written in a very nice way, like a story. It sold in millions. It became the bestseller. I remember those years, 83, 84, 85. Everywhere, Fritz of Capra, Fritz of Capra, Fritz of Capra. He came and then talked. So if some of you have come across, fine. Otherwise, all of you should read that book. All the doctors, all people should read that book. Because it's very nice, only 250 pages. From the time of Newton Descartes, how science started growing, how technology came up, what are all the dividends that we got, what are all the new dimension technology he developed, and what are all the advantages we get, how our lifestyle changes, and then what are all the problems that it has created. Everything he has brought out so beautifully. Once you start reading, you don't feel like stopping the book. So in the end, he says, please remember what Newton said. After completing the understanding of the physical world, time has come, we have to go beyond the physical. To understand, is there something like life, prana? What is the difference between a dead body and the living body? Living body has the prana, it doesn't have the prana. What are the laws that govern the prana? What is prana made out of? Then what is mind? What is the difference between mind and intellect? Is there a difference between mind, intellect, and emotions? What is it that we call as consciousness? What are devils and pishachas? Do gods and goddesses exist? Into this region of subtlety and causality, the science has to move, he wrote. So we are all in that embryonic stage in understanding the physical world. And therefore, a challenge related to these subtle dimensions of the universe, we have no solution. But stress is one, sir. NCDs belong to this category. Stress is not merely physical. Mental restlessness can cause stress. And emotional upsurges, anger, greed, jealousy, hatred, infatuation, arrogance, all could be causing stress for you. Deep-rooted psychological conflict between husband and wife, parents and children, one director and another director, all are the base of stress. So stress is not merely physical, it's a multi-dimensional challenge that we face. Similarly, NCDs belong to this category. So the challenges today are multi-dimensional, physical, mental, emotional, intellectual. So multidimensional challenges need multidimensional solution. But what does science project us? Modern science is only physical, one dimension. How can you solve a multidimensional challenge by a one-dimensional solution? That's why we have failed to meet the challenge of stress and the non-communicable diseases. Modern science and technology developed in the West have failed to tackle the problem of stress and the NCDs. What is the way out? Is there any way by which you can do that? It's here comes India. India has a full knowledge base. And this all contained in yoga, spirituality. So how to bring the total knowledge base into our day-to-day life is what you call yoga. So yoga can meet the challenges, multi-dimensional challenge. Then take the green. Yoga is the answer. Yoga is the science of holistic living, featured by health, bliss and poise, hormone and efficiency. So the key effect, key process of yoga is to gain mastery over the mind, said Patanjali. So Dr. Nagendra coined the thing, M. You can remember what is yoga? 3 M's, M. What is that? Mastering the monkey mind. The word is what is the monkey mind. So by so doing, what happens? Yoga helps us to rise from our animalistic level to become normal human beings, featured by discrimination, to become great human beings and superhuman beings, featured by higher powers and selflessness and so on. Then go to divinity and reach perfection itself. Yujyate anena iti yoga. Yoga is to raise ourselves from our normal level to the highest level. As it said normally, Jivatma merging with the Paramatma. Our Honorable Prime Minister has given a new expanded vision of yoga. What is it? Yoga should build families. Individuals become families. Families all should become one in the whole country. All countries should join together, become one world family. And that is what yoga aspires to do. Yoga is the joining. This is what Swami Vivekananda in 1893 in the Parliament of Religions in Chicago. He gave that wonderful talk. He called, "My dear sisters and brothers of America," he said. When he was telling this, he was not just trying to attract. It was not just a marketing gimmick, but he was bringing the whole essence of our Indian culture, the entire yoga dimension. So he expanded the vision and said that we had to make yoga a socially relevant science. How? Don't neglect the West. West has done fantastic things, wonderful growth. It has brought on all fronts, technology, science, everything. We have to combine the best of the West, but don't neglect or belittle East. We have got the total solution in the East. Combine the best of both, best of the West to the best of the East. That is the direction that Swami Vivekananda gave us. So this is based on the total concept of the entire creation. According to Yoga Shastra, according to our Sanatana Dharma, this entire creation is not only physical. There are 5 layers. We do not have only the physical body. The physical body Apart from that, we have 4 more bodies. The causal body is called Anandamaya Kosha. Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, Anandamaya Kosha. Ananda Kosha is from where all other koshas have come. Similarly, this entire creation is not only the physical world, it is the Annamaya Kosha, electromagnetic field. Then we have the bioplasmic field, Pranamaya Kosha. Much bigger than that, more pervasive, more deeper is astral field, Manomaya Kosha. Then we have the information field, intellectual field, Vijnanamaya Kosha. And we have the bliss field at the most. So this is our causal state. This Anandamaya Kosha is a state in which we have absence of all miseries, full of happiness. We can say it's the total health. Then mind is not working then. The simple example of Anandamaya Kosha example is deep sleep, sleep without dreams. Then you come to wakeful phase. Vijnanamaya Kosha, mind starts working. Then we recognize differences. I am different from you. He different from him. He different from him. Goes on. But in Vijnanamaya Kosha, you have complete knowledge base. Krishna says that there is Trikala Gnana. He says, I know what is past, what is present, what is going to happen in future. Everything is known. He says. Such are the great masters in our country. It's not only the epic characters like Krishna or Rama and others, but in our country, every state develops such great masters. We have Santa Grande from Maharashtra, Swaminarayan from Gujarat, Ahari Mahasaya, Ikshveshwargiri from West Bengal, and we had large number of Hatha Yoga masters from Madhya Pradesh. We had Guru Nanak from Punjab area. In Tamil Nadu, we had a number of Siddhars who came, and Raghvendra Mahaswami and others from here. In Kerala, we had Shankaracharya. All these people executed fantastic capacities. That is Trikala Gnana, and mostly they are the people who set the thing. From there you come down to the Manomaya Kosha, the body of the will. Slowly you condense further. And mind starts working faster and faster. And the emergence of emotions come, likes and dislikes. Slowly these emotions start governing us. The 6 enemies of man, as it said, anger, greed, jealousy, hatred, infatuation, arrogance, kama, krodha, lobha, moha, mada, matsarya. 6 enemies. What do they do? They know what is right. They don't allow you to do the right things. This is called emergence of Duryodhana. Duryodhana is not just an epic character. It's a personality trait within us. What he says, Janami dharmam, nachame pravrittihi. I know what is right, I don't do right thing. Janami adharmam, nachame nivrittihi. I don't have escape from doing wrong things. Therefore, I'm doing more and more wrong things, more and more wrong. Every diabetic knows that I should not eat my fond gulab jamun or rasgulla because my sugar always gone up. A1C level has gone to 9, 10. So doctor has said you must stop eating everything, all sweets. But when you encounter all sweets in my friend's marriage party where I have gone, what happens? I start looking at today, in marriage parties, how many sweets are lined up. You start looking. What happens? Kurukshetra war. What? Buddhists are don't eat. Endocrinologists. Come on, go and eat. What is there after all? Life is for enjoyment. Go there and have one more diabetes tablet or maybe insulin. Why? Come on, eat. So, what wins matters. If your tongue wins, you are in for trouble. That is where the stress starts. That's called adhi. Manomaya kosha is the common stress. the modern stress. Stress begins in the Manomaya Kosha, and it is the seed of stress. An imbalance is created between the silence and activity. Activity takes over. And what is the yogic definition of stress? Stress is uncontrolled speed of the mind. Restless mind. No control. Excess speed. It all becomes in the Manomaya Kosha. It's called Adi. Then from the Adi it comes down to the Pranamaya Kosha. In Pranamaya Kosha, everything is in a beautiful balance. A beautiful lake. Take a big stone and then throw it. The whole thing gets disturbed. It becomes violent. So all the Pancha Pranas, they start going hither, thither, wrong directions, wrong quantities, constriction, blocks, everything starts occurring. And then start affecting our breathing, haphazard breathing. It's something like a clear lake getting totally disturbed, a turbulent lake. So if you look at the chakras, which are in a beautiful straight line, all the Shat chakras are there, they all get disturbed. Pancha Pranas get disturbed. Then it percolates down to the Annamaya Kosha. Start hitting the higher centers of the brain. Left, right brain lobes commit imbalance, autonomic imbalance, endocrine imbalance, percolates into each and every organ in the body. Imbalance. And depending on which organ is weakest, that particular thing succumbs. Supposing your parents have diabetes, you are also likely to get diabetes, then you succumb to diabetes. If your parents have hypertension, you are likely to get hypertension. Goes on. Annamaya Kosha. Therefore, Adi, chronic imbalance, becomes the Vyadhi. Called Adhija Vyadhi. All NCDs belong to this. They're called the Vyadhi generated by Adi. What is the way out? You have to remove the root cause of the disease, Adi. So in Ayurveda, it is defined. Swasthasya swasthya rakshanam. Aturasya vikara prashamanam. This is the thing that's happening. That means you have to promote positive health, prevent diseases, holistic management of diseases, and rehabilitation, complete rejuvenation. So we have to do this thing. This is the aim. So our healthcare delivery system should do this dimension. This is what we do with the integrated approach by health systems integration. We have to bring about a lifestyle change. So what do? Annamaya Kosha. We use all the things of allopathy, Ayurveda, medicines, physiotherapy, naturopathy, osteopathy, chiropractic. In yoga, we use asanas, kriyas, integrated diet things, all these things we use the Annamaya Kosha level. Pranamaya Kosha level, we use pranayama, and we have the marma therapy of Ayurveda. Then we have the TCM, acupuncture, qigong, homeopathy. Manomaya Kosha, we have special herbs and diets, meditation, mantras. Then Krida Yoga, the Bhakti Yoga. All these things are used at the Manomaya Kosha level. Vijnanamaya Kosha level, use psychology, modern psychology, psychiatry, yogic lectures and yogic counseling, behavioral therapy are all used. Anandamaya Kosha, use the wonderful technique of Karma Yoga, working in relaxation, working in stress-free condition, working in blissful awareness. These are the ways that we do. This is how we work at all the levels using various systems. Similarly, the integrated approach of yoga therapy called AYUSH. Does it have? You can see this. So at the Annamaya Kosha level, we use kriyas, cleansing techniques. We have Sukshma Yama. Then muscle loosening practices, Shithalikarana Vyayama. Then which loosens the practice and strengthens the muscle. Then we have the asana. Yogic postures is known today as yoga all over the world. But in one small portion of the entire Ashtanga Yoga, Raj Yoga, relaxation is the key essence. So what are asanas different from physical exercise? Relaxation. As Patan said, Sira Sukham Asanam. So we do nice the Shavasana. 3 types of Shavasana, IRT, QRT, DRT. And what about the diet? So Dr. Nagendra said, you must eat a lot of vegetables. He gave a formula in Kannada, it's called TTT. What is TTT? How many of you know Kannada? Kannada, how many of you know Kannada language? It's called Satte Tumba Tarkari. That means plenty of vegetables in this thing you use. That is the Annamaya Kosha operations in this. Then in Pranamaya Kosha, what we do here, we got the breathing practices. Allopathy, Pranamaya Kosha, and Pranayama. Core essence of Pranayama is to slow down the breathing. Our normal breathing speed, what is the normal breathing speed? 15 to 18 per minute. We should go on reducing. 15 per minute, 10 per minute, 5 per minute, 2 per minute, 1 per minute, then 1 in 2 minutes, 1 in 3 minutes. This is advanced pranayama. So I must understand that pranayama is to slow down the breath. When you slow down the breath, the mind also will start coming down. Therefore, how you understand SSSR? That is slowest rate of breathing. How do we measure whether we are going in the right direction? We have Brahmari time. Take a deep breath and calculate how many seconds. As you improve in pranayama, the Brahmari time should increase more and more. This is the essence of pranayama. Then the mind also starts coming down. The uncontrolled speed of the mind is going to come down. Adi is going to be addressed. Then in Manomaya Kosha, we have the Dharana, Dhyana. Dhyana is meditation. Here we are using Om meditation and cyclic meditation. Cyclic meditation gives very deep rest. How much rest? If you have 6 hours of good sleep, normally you get 9% rest. But if you do CM 35 minutes, you can get 32% rest. Papers have been published. So we adopt that. It's based on the Mandukya Karika. Then we have mastering the emotions. We have the Krida Yoga. Then the dimensions of bhajans and others. Right? So we work at all these towers. Then Vijnanamaya Kosha, what do we do? Theory. We have the lectures, you must understand. So in our course, we have got both theory and practice. No? So we say practice is most important. An ounce of practice is equal to tons of theory, it is said. Similarly, when you do the theory and practice with theory, it will give you 100 times more result than this. So theory and practice. So through the lectures, we give the theory portion, knowledge base. That alone is not enough. Therefore, we have the counseling, yogic counseling. So by yogic counseling, we'll be able to bring out the principles of this thing into our day-to-day thing. Then we have the Anandamaya Kosha. Anandamaya Kosha is to learn how to work stress-free. If I work in 10 hours, 12 hours, 14 hours, can you still have a stress-free way of doing it? Action and relaxation. And we have the wonderful way of, blissful way of working, BWW. So for that, in our Arogya Dham, we have got happy assembly. And we have Krida Yoga, all these things involved. So this is how we work out all the 5 portions. What does allopathic system do? Essentially, it deals with only the physical level. It deals with the symptom. It gives you the result, but the root cause is not removed. That's why no cure for this century. So therefore, it is this integrated approach of yoga therapy, integrative medicine that can help. For the result of that, you have to completely change your lifestyle. Our lifestyle has changed because of our TV, because of our things. We sleep very late, 12 o'clock, 1 o'clock, 2 o'clock, 3 o'clock. Most of our children, they start sleeping at 2 o'clock, 3 o'clock. Morning, they get up at 9 o'clock, 10 o'clock. It shatters your biorhythm. That's one of the root cause for all the stresses, ADHD and others. Change. So when people come here to Rogadam, they're asked to sleep 10 o'clock. Morning, they automatically get up at 5 o'clock. Sleep early in tune with the biorhythm of the body. Then tailor-made practices of IIBT knit into daily routine. And people come here, we don't call it a hospital, we call it a Arogyadham, the health home. So from morning 5:20 up to night 10 o'clock, we have got all this integrated approach that we have talked about. But if you go to a hospital, doctor will come to the consultation, give a little counseling, give some medicine, parents. Rest of the time they are free. Here, they are completely engaged to give the entire dimension. There's miracles occur here. And on a daily basis, the entire progress is monitored by measurement. So we have the physical symptoms, the blood test. We also measure what is happening in the pranamaya portion. You have the special equipment called BioWell. You can photograph the entire pranamaya portion, see where are the imbalances. That's all we do. And psychological aspects we do. So the health integration takes place. Integrative healthcare services, central departments. In our WASHI, that is Vasitha School of Health Integration, we have got all these sections: cardiology, pulmonology, endocrinology, gastroenterology, all these things you have. Promotion of positive health as well. You want even normal people to come to prevent diseases, to promote positive health. So here we have got devotional sessions, educative, yoga, entertainments, medicines, yoga equipment, books, DVDs and publications, yogic counseling, yoga-based vegetarian diet, integrative diet. These are all things available here. So when you're all going to come here in the end of your course for 1 week to 10 days, you should get maximum benefit of your stay here in Prashanti Kutiram. So that please follow the entire routine that has been given here. That's how we put the entire timetable. With that, we close today's session. I hope you got a broad picture as to why we have to integrate today. Because modern medical system alone is not able to give the complete solution to our modern NCDs. So we have to add on dimension. We have to not only give symptomatic reliefs, pain relief and others, but you have to go and remove the root cause of the disease. Then only we can do these things. And we have been able to do that over the last 4 decades by publishing large number of research papers, nearly 1,000 research papers. We have been able to show hundreds of asthmatics, thousands of them have become normal. Hypertensive, heart people, cancer people who were declared dead in just 2 to 3 months, they have lived for 20 years. This is the wonder that integrative medicine can do. So with that, we wish you all the best and good luck. Thank you very much.
Thank you very much, Guruji, for a very enlightening talk. Now I request the participants, if there are any questions, you can either put it in the chat box or
You can put it in
unmute
the chat
yourself.
box also if they want.
Yes, you can either put it in the chat box or unmute yourself and you can ask the question.
Any question?
Namaste, Guruji.
Namaste.
This is my name is Dr. Chetan Biadgi. I'm calling from near Salisbury in Pennsylvania. I'm representing Arshavidya Gurukulam. I'm a volunteer and a completely dedicated person at Arshavidya Gurukulam. And when I told my staff that I've joined this course, and our manager, Siddharth Marji, said that Puja Swamiji, Sri Dayananda Saraswati Ji had blessed you. And so I'm just conveying my regards to you. And I'm very glad that I'm with you in this course, sir.
Very good, very good. Thank you. Good.
I have a question.
Yes, Dr. Vaibhav, you can ask your question.
Sir, recently I had come across a video in YouTube actually.
Fast pranayamas like Kapalabhati or Bastrika, how do they affect pranamaya kosha? So the fast breathing techniques come under the broad heading of cleansing techniques called kriyas. Kriyas or fast breathing thing, Kapalabhati. And similarly, the fast breathing is the one that cleanses the entire thing, respiratory thing. So it increases the metabolic rate and thereby it stimulates and removes the thing. For example, if in a pipe there is a lot of dirt, you force the water to go very fast, therefore the entire dirt which is there is carried away. Similarly, in our breathing respiratory system, when you do the fast breathing, it is going to cleanse the system. Another thing that happens is the desensitization process that takes place when you have the Kapalabhati and other things. Whereas the second dimension near pranayama is to slow down. That is the one that decreases the metabolic rate and thereby the mind also calms down. And when the mind calms down, the adhi starts reducing. The root cause for the adhi, which is root cause for all NCDs, have to be reduced. So that is the way that we have to work on this thing. Is it possible to prevent this through lifestyle management? Yes. Lifestyle management is the key essence. Ultimately, yoga is to bring about a change in our lifestyle. And there are a lot of research that has undergone in hypertension in Royal Free Hospital in London, almost 35 years back. What they found is that when they had the long-term study for 3 to 5 years, it is the lifestyle change that brings about the changes. We had a long-term study on bronchial asthma for almost 8 years. We took the data on 660 patients. And what did we find? three groups emerged. First group called as the regular group, who practiced yoga 24 days, 1 hour per day at least. That's called regular group. Second group, irregular group. They start doing and leave it. Again do, again leave. Again do, leave. Irregular group. Third group, after doing for some time, they left everything. What was the result of all the things? We found regular group with the maximum improvement, but all groups got improvement. So we're quite surprised how they have been able to reduce the medication, how they have been able to become almost normal. We went and talked to the discontinued group. And what they said is, sir, we are a little apologetic that we have not been able to do yoga practices 1 hour that he has prescribed. But our lifestyle has changed. We used to sleep very late, 12 o'clock, 1 o'clock. Now it's all stopped. 10, 11, 11:30 maximum we sleep. Morning we'll get up at 5 o'clock, 5:30, 6 maximum. This was changed. Earlier we used to eat all types of things anytime, but now we know we have control over the food we have. And as far as rainy season used to come, we used to take a lot of medication because we know we'll get this thing as a prevention we have to take. But now we know yoga chair breathing and we use chair breathing, therefore we don't have to take. So like that entire lifestyle has been changed. This is what they said. This is the result of the entire dimension that we had to do. It is not only that you do the practice, even if you don't do the practice, if your lifestyle is changed, then it's going to bring about the result. That is the dimension that we have seen.
There is another question, Guruji. It is from Dr. Vaibhav, where he says that he has come across several videos from your YouTube regarding the mind-body healing in fourth stage of cancer patients, especially through intense meditation techniques and body healing techniques. So he's asking, how true is the healing to the depth actually? How true is the healing to the depth?
Post-cancer treatment.
Yeah, in fourth stage cancer.
Fourth. Okay.
In fourth stage cancer patients, he's asking how effective are this intense imagery meditation techniques?
Sir, actually, I had come across some videos in YouTube wherein, case of Anita Murjani and all. And I've also come across a website. I've also heard of a doctor called Dr. Joe Dispenza from USA, wherein he deals with patients with fourth stage cancers and all possible chronic illnesses.
And
Wherein,
put in the chat box.
yes, sir. Can you hear me?
Guruji, he's asking what is the role of these imagery intense meditation techniques in healing fourth stage cancer?
I have actually come across situations. I mean, I've seen videos wherein the patients with fourth stage cancers and chronic illness have healed themselves. So, how genuine are they, and is it really possible? That's my question.
What are they? Several YouTube regarding mind-body healing, where even the fourth stage cancer patient have healed themselves through intense meditation to this. Yes, I was telling you about this also. We had a number of things in 1986 when we had our first encounter with almost burnt up case of cancer. We had a very big thing here, Kidwa Memorial Institute of Oncology in Bangalore. Dr. Krishna Bhagrava was the director. And there were people who undergone that surgery, radiation, chemotherapy, and they were almost declared dead. They said, we can give you only painkillers. But they said, you cannot live more than about 3 to 6 months. But they said, why don't you go to yoga? Probably some pain relief can come. That's how they came. 6 people came. That is bone cancer, breast cancer, and leukemia. And myself and Nagaratna, we started teaching every day, 5 to 7 o'clock, 7:30. First 1 hour theory, 1 hour practice, half an hour interaction. And all of them started feeling so good, and see that they started becoming better. I remember within 10 days, one of the maths teacher is a professor, and she was about 35, 40 years old. She had breast cancer in the final stage. He came and told Nagaratna that, see, I'm feeling so good. Can I start going for work? Last 2 years, I have not been able to work. Then Nagaratna said, yes, you go, but be careful that you don't get stressed up. You do that for just 2 or 3 hours and gradually build up. He started doing that, and he lived at the age of 64, and that is the wonder that we have seen. From there, we started our RCT trials in Kidwa Memorial and Healthcare Global now, and MD Anderson Cancer Center. We have got a number of such things and shown that yoga could work wonders. What is the basis? Adi is the root cause, stress. Stress is the immunosuppressant factor. When the immune gets suppressed, then the cancer cells start growing in the encounter. If you strengthen the immune system by reducing the stress levels, then the cancer cells get destroyed. That is the thing that happened. In a subtle way, Patanjali gives that it's the viparaya that occurs. Viparaya is the wrong notion. What is the wrong notion? Seeing a serpent in a rope, seeing a ghost in a post. And this is the wrong thing that happened. And therefore, immune system has the capacity to see what is right, what is wrong, who is friend, who is the enemy. It knows that the cancer cells which are born in our body, they are not invaders from outside. They're all born within it. They are not born the way they have to be born. And therefore, immune system takes care of them, gobbles them up, and finishes them. Them to grow. In 5 years, 10 years, 15 years, they become a tumor. Then we go to the doctor. We have got surgery or chemotherapy or radiation therapy to kill them. But the root cause is not removed. As a result, again, they get back. So what we do in yoga is to reduce the stress level. Therefore, this viparaya goes away, immunosuppression factor reduces, and they start getting the whole dimension. That's how the Adi are dealt with. Therefore, the integrated approach of yoga therapy, in integrative medicine, what we have to do is to address the root cause of the disease. And we have hundreds of such cases who have come and they have got wonderfully well. That is the lifestyle change that occurs there.
We'll take one last question, Guruji. What are the indications and contraindications of Brahmari Pranayama and why? Dr. Suraksha Harshini has asked.
Brahmari Pranayam is very, very helpful when it is done in the right way. In the Brahmari, even without keeping the hands like this, etc., you take the breath. You can start doing that, and feel the vibration throughout the body. If you do it at a very gross level, it will not give the type of results that are needed. And if you do it with lot of kumbhaka, particularly, many people do Brahmari with kumbhaka. Kumbhaka pranayam could be very dangerous. In the kumbhaka pranayam, you must see that the bandhas are mastered, the Budhyana bandha, the Mula bandha, and the Jalandhara bandha have to be properly learned and do this thing. If they don't do this thing, there can be contraindication. Otherwise, Brahmari is very good and you use it nicely.